Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McRae.
According to the National Institutes of Health, there are more than 800,000 strokes each year in the United States. Interestingly, stroke is the fifth leading cause of death in the United States and causes more serious long-term disabilities than any other disease. A stroke occurs when the blood supply to part of your brain is interrupted, depriving brain tissue of oxygen and nutrients.
The good news is that strokes can be treated and prevented, but knowing the warning signs and taking quick action is key. May is National Stroke Awareness Month. Here to discuss is Mayo Clinic neurologist and stroke expert, Dr. Robert Brown Jr. Good morning. Welcome back to the program, Dr. Brown.
Good morning. Great to be here with you.
All right. I don't even know how many times you have come on our program to talk about stroke, but it is so important that it gets its own month of highlighting stroke awareness. So explain why, are people becoming more aware of stroke? Let's start there.
Well, because stroke is a preventable and treatable condition, as you just mentioned, our goal is to get the word out to the greatest extent possible. So when people have stroke-related symptoms, they immediately recognize it and they will seek emergency care, for one. And number two, stroke can be prevented. Not always, but sometimes. We want to make sure people are aware of the risk factors for stroke.
So, Dr. Brown, there's a spectrum of symptoms from a stroke. So can you go through those and when one should worry and when one shouldn't?
Yes, certainly. Well, the symptoms at presentation of stroke include the sudden onset of weakness of the face, arm, or leg, sometimes in combination, sudden difficulty speaking, sudden difficulty understanding others, sudden blindness in one eye or the other, sudden unexpected headache unlike anything they've ever had before. So these are the classical symptoms of stroke, and you can get what I'm pointing out here. It's the sudden onset of difficulty doing something, oftentimes, is the key symptom at the time of stroke.
But sometimes, as you said, these are the sudden and they're long-lasting, but you can also have transient symptoms. So how does one determine if this is just something that's going to go away versus something more serious?
Yeah, and for the layperson in the room, the transient symptoms. Explain that, please.
Yes, absolutely. Well, the symptoms I just mentioned a moment ago may come on and last for several minutes or hours and then resolve. And that's historically called a transient ischemic attack. So symptoms that can mimic stroke, but they're transient. They come and go. Now, very importantly, whether those symptoms are transient or whether they come on and last hours or days, it's still a very important symptom. And even if the symptoms come and go, it's important to present to your provider, to an emergency department, and share the fact you've had these sudden onset of symptoms, because that does predict a very high risk of stroke in the hours and days that follow.
And now, I don't know about all around the world. I mean, this radio show goes on to over, I think, 177 stations now we have. But I will say that in the Midwest, on the farm, that transient ischemic attack is called a spell. And my relatives would have a spell, and they would say, oh, it's just a spell, don't worry about it. And it's true. My grandpa would be better after he had a spell, but ultimately died of stroke, as did my father. So are people hearing the lesson about the TIAs, about spells, and reporting them to their doctors more now than they used to?
I think the short answer is yes. The little bit longer answer is because now we have strategies available to prevent a future stroke after these TIAs occur, or we have acute treatments that exist in the emergency department setting for someone presenting with a stroke. It's more and more common the situation a person does recognize it and seeks emergency care. But unfortunately, not all people recognize those key symptoms of stroke I mentioned a few minutes ago.
Right.
And given how important these symptoms are, is there an easy way for people to remember those symptoms?
Yeah. Well, there are many different strategies. One that has been marketed most aggressively is FAST. F for face. Facial drooping is sometimes a symptom that can occur. A for arm, arm weakness. S for speech, slurring of the speech can occur. And T is for time. Emergently seek care, because time is of utmost importance when it comes to treating a stroke.
Am I imagining it, or are younger people having strokes these days than even a generation ago.
Well, importantly, just as you're getting at, stroke is not just a disorder of older people. Stroke can affect someone of any age. It affects both genders, women slightly more common than men, people of all races and ethnicities. So this is a disorder that's pervasive in all people. And in answer directly to your question, we're now recognizing that younger people are slightly increasing in terms of their overall occurrence of stroke compared to years past. And there's many reasons behind that, but we are recognizing stroke in younger patients.
So there are younger people having stroke for the same reason that older people have stroke?
Yeah. Well, I should step back and mention, it's useful to point out, there are two key types of stroke, and I think it's important to start with those basics.
Sure.
The two key types of strokes are ischemic stroke, or a lack of blood supply to the brain, caused by a blockage in the artery for one of many different reasons. And then there's also a bleeding or hemorrhagic stroke, and what happens there is that the blood spills outside of the artery into the brain tissue. About 85% of strokes are ischemic strokes, the lack of blood supply strokes. About 15% are the bleeding types of strokes.
So the ischemic one that you mentioned, is that like having a heart attack but for your brain?
Exactly right. And the key difference is when it comes to the arteries of the brain, there are so many different factors that can lead to that blockage, as opposed to in the heart, there are much fewer or fewer conditions that can lead to the blockage in the heart artery.
So when it comes to the ischemic versus the hemorrhagic, do young people have one more than the other? Do elderly people have one more than the other?
Well, actually, both of them are of higher occurrence as we do get older.
Okay.
But both hemorrhage, bleeding types of strokes, and lack of blood supply strokes can occur at virtually any age.
Okay.
The most common cause of a lack of blood supply stroke is atherosclerosis, or plaque. Plaque being laid down in an artery either of the neck or up in the brain tissue, and then that plaque can lead to a narrowing and then ultimately a blockage of the artery, somewhat akin to that same plaque that can form in the heart arteries, just as you mentioned.
So, Dr. Brown, let's talk about that a little bit. We talked about age and we talked about plaque. What are the risk factors for stroke?
The key risk factors, there are 4 major risk factors: high blood pressure, cigarette smoking, elevated cholesterol and other lipids, and diabetes. So those are the big 4, the most important risk factors. Other risk factors, though, include a sedentary lifestyle that is not getting much, if any, exercise, obesity, being overweight, obstructive sleep apnea, which is a certain sleep disorder that can occur, and then heavy alcohol use. Those are some of the other risk factors as well.
What about ethnicity? Does that have a role to play?
Great question. In terms of ethnicity, African Americans and Hispanics are of slightly higher risk of stroke compared to whites.
We've been talking about Stroke Awareness Month with neurologist Dr. Robert Brown. We're going to take a short break.
When we come back, myth or matter of fact, you can recover completely from a stroke. We'll find out.
Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McCrae. We're talking about stroke with Mayo Clinic expert Dr. Robert Brown. So, Dr. Brown, myth or matter of fact, a patient who suffers a stroke is able to completely recover from that stroke. Is that a myth or is that a fact?
That is a fact.
It is.
It is, with aggressive treatment of that stroke, as well as with appropriate physical therapy and speech therapy and so on. Fortunately, some people who suffer a stroke can come to have no or minimal deficit after that stroke.
Wow. So before the break, we were talking about risk factors for a stroke. And so I just wanted to ask you about the role of oral contraceptive pills, especially in younger ladies. Is that a significant risk factor for developing a stroke?
The risk of being on an oral contraceptive and the risk of stroke is extremely small. And in addition, because the risk of stroke in young, otherwise healthy women is small to start with, that incremental risk is just tiny. Now, if a young woman is a smoker or has high blood pressure or diabetes, then adding the oral contraceptive can increase the risk a bit further. But in the absence of those risk factors, the risk of stroke on oral contraceptive is very low.
Smoking, blood pressure, diabetes. What about family history? What if, like I was saying, my grandfather, my father? I mean, what is the family history in this part play?
Yeah, family history is important, and we think about it in a couple of different ways. Sometimes the elevated risk of stroke in the family is related to risk factors that high blood pressure, high cholesterol, diabetes might be running in the family. Now, separate from that, there are some circumstances we see where the family-based risk is separate from those risk factors, and that can help to guide us in terms of our stroke prevention strategy. So we always ask about family history. That helps to guide us.
So, Dr. Brown, speaking about preventative strategies, what's your thought about taking a baby aspirin? Is that a good thing to do? Should we take it every day? What do you think?
Yeah, great question, and it is individualized to a specific person. The problem with aspirin, and I'm the first to say aspirin is a great medicine. We use it very, very frequently in the field of neurology. But the problem with aspirin is it does have some potential downside as well. It's a blood thinner, albeit mild blood thinner, and so there is a risk of bleeding, whether it be into the stomach tract, if you will, or even into the brain or other parts of the body. So it depends on your specific profile. If you reach a certain age, oftentimes in the 50s, in your 50s, and have other risk factors like high blood pressure, high cholesterol, or diabetes, you may end up taking a low-dose aspirin, and it might be greater risk or greater benefit than risk, but it's really individualized.
All right, let's talk about treatment. Because you said if you recognize the FAST, let's see if I can do this, the face, arm, the speech, or the time.
Very good, Tracy.
Yes.
I just about remembered the F.
Did you see? He's like, it's time. So you get into the emergency room. Then what happens? What is the treatment?
Well, treatment for stroke has changed so markedly, certainly during the course of my career. In the late 1990s, it was identified that a clot buster, tissue plasminogen activator, a strong clot buster, could be used to try to break up that clot that is blocking the artery, leading to the blood starting to flow again and reducing or improving rather the outcome from the stroke. Now we've gone even one step further beyond that, and now we're using, I'm going to say, catheter-based devices. Well, what does that mean? It means you put a little plastic tube in the groin artery, advance that catheter all the way up into the brain artery,
Wow.
and extract the clot from the artery directly via that little catheter. And so that's oftentimes what we might do now in an acute stroke setting. Give the clot buster and then immediately go to the angio lab, and our interventional neuroradiology and neurosurgery colleagues can go ahead, advance that catheter, and extract the clot directly from the artery.
The clot busting drug that you're talking about, can that take care of it so that by the time you get there with that catheter that it's already gone, or is it still left behind?
Yeah, it's a great question. And in a small percentage of people, the intravenous clot buster can break up the clot to a sufficient degree, but we'll oftentimes know that even by the time we get to the angio room, the deficit, meaning the symptoms that a person is experiencing, will begin to improve, and sometimes we can then avoid the angiogram, but oftentimes the clot remains, and then we need to go in there and see if we can't extract it, take it out of there.
And Dr. Brown, I can imagine that time is of the essence for this. So are we talking a matter of minutes, hours, days? What are we talking about?
Well, when it comes to giving the clot buster intravenously, we try to give that as quickly as we can. Now, we can extend the window up to about 4.5 hours for the intravenous therapy and up to 6 hours for the direct arterial therapy that I mentioned a moment ago. But I think the key point is the earlier we can treat, the better off a person will be. And it's amazing. Somebody who's treated at 90 minutes compared to somebody who's treated even at 120 minutes, the likelihood of a good outcome is much higher at that 90-minute mark than at 120 or 150 minutes. So every minute matters.
And we've talked in the past about the robots that are helping patients in far-flung parts of the country where maybe there is not a neurologist on staff. Tell us a little bit about that. Is that still going along? Is that still progressing?
Yeah. And what Tracy is getting at is the concept of telestroke. And what that means is a provider at a major medical center would interact with a colleague at a smaller medical institution an hour or 10 hours or whatever the case
Out
might
in the
be.
middle of the
out in the
range.
middle of, out in the middle of
Right.
nowhere, if you will. And we can see that patient via an audio-video connection. We can perform an exam. We can review the CAT scan, which is the picture of the brain, and we can help to advise them regarding whether they might start that clot buster and then transfer them to a major medical center. And these telestroke networks are present throughout the country and really throughout the world. And that's one way of connecting with people who are hours away from a major medical center.
Now, Dr. Brown, you mentioned earlier that most of these strokes are the ischemic one where you have a blood clot, but sometimes you can have a head bleed.
Yeah.
So how do you know if you have a head bleed? Because surely you wouldn't want to give this clot-busting agent if you have a head bleed. How do you know that?
Great question. And the short answer is the symptoms can sometimes help, but the CAT scan, obtaining that picture of the brain, a CAT scan provides very, very quickly information for us in terms of, is it a bleeding type of stroke or is it a lack of blood supply type of stroke? We'll know that right at that point and then be able to implement the best treatment.
How likely is a patient to survive a bleeding type of stroke?
Yeah. Well, bleeding type of stroke, and here again, there are a couple of different types, but that's a very serious type of stroke as well. And even at the 30-day mark, about a third of people who have a bleeding type of stroke will have died from that stroke. So
Wow.
it's a very serious type of stroke. A brain aneurysm, which is a little saccular little bubble-like outpouching off an artery, that's one of the causes of a bleeding type of stroke. High blood pressure, though, very important risk factor for bleeding type of stroke as well.
And what now in these final part of our interview here should people do to prevent or lower their risk of having a stroke?
Well, I think most importantly, know your blood pressure. And if you have elevated blood pressure, seek out appropriate treatments. There are many excellent treatments for high blood pressure. Know your cholesterol level. And if it's elevated, whether it be with dietary factors or medications to lower it, if you have diabetes, control it very, very nicely. And stop smoking. If you smoke, work with your provider to do anything possible to quit. And then beyond that, exercise. Even a small amount of exercise on a daily basis will lower your risk of stroke.
Final question to the bleeding type of a stroke or the ischemic type of stroke. Is the brain damage that a patient would suffer, is that reversible, or what happens with their recovery?
Well, the brain damage that occurs at the time of a stroke, when there's that lack of blood supply to the brain, the damage itself actually occurs very, very quickly.
Yeah.
And that's why we need to treat so quickly. However, with the appropriate treatments I just mentioned to get the blood flow started, and then with appropriate therapies, physical therapy, speech therapy, and so on, can be extremely effective in treating patients. One area of stroke neurology that's out there right now is whether stem cells may become a treatment after the acute period of stroke. And that's in experimental phase right now, but that's a potential direction we might be going in the future.
May is Stroke Awareness Month, and we've been talking with neurologist and stroke expert Dr. Robert Brown Jr. Thanks for joining us, Dr. Brown.
Thank you again. Appreciate the opportunity to be here with you.